Okay, this is a great question. It's on, is there a risk of breast cancer with using the natural progesterone? No, there's no evidence that progesterone increases breast cancer risk. In fact, the epidemiological evidence shows that it decreases breast cancer risk. Now, Provera, Primpro, absolutely increases breast cancer risk. Actually causes breast cancer, in my clinical opinion. Based on the post-WHI data, there is causality with Provera and breast cancer. But there's a very large study called the E3N cohort that's looking at this. And I'm very comfortable in using progesterone in my patients, and I do not think there's any evidence that shows there's an increased breast cancer risk with progesterone, with the natural progesterone. I use it myself. I have a strong family history of breast cancer, and like you saw in the case histories, because of what the data says, I'm comfortable. Okay, is this our one more question? Two more questions. Okay, Sylvie. All right. Well, thank you for your compliments. I appreciate your interest in the book and your comments. Yes, saliva testing is not just for perimenopausal, menopausal women. There are so many applications of this type of evaluation. I learned about saliva testing at the National Institutes of Health when I was a medical student. It has been used at the NIH since the 1960s. It's a very accurate measure. Again, you've got to be choosy about your lab. I have my patients tear the things out of magazines and say, oh, well, see, Dr. Stevens, is only $52. Can I get my saliva test here? And I'm like, no, you may not. Because I've got to be confident that there are quality control issues in place, and I'm going to get an accurate laboratory assay. So some of the applications that I use in children and teenagers would be for learning disorders, for mood disorders, for hormone disorders, seizure disorders, asthma, acne. All of those I would test prepubertal or pubertal, male or female, and there are reference ranges established for those ages. And then I do see males in my practice, certainly not as many males as females, but certainly test men. It's extremely important if they have a family history of cardiovascular disease or prostate cancer or personal comorbidity, that you know what's going on with their, not just testosterone, but also progesterone. I use progesterone in men. It has an antihypertensive effect. It has an analgesic effect. There are some studies with IV progesterone at Emory University being used for acute brain trauma. And it's being used in Iraq right now, IV progesterone in males and females for acute brain trauma. So sure, you can test the guys, and you need to get your guys hormonally balanced as well, and there are reference ranges for them. Now, I don't have much success with the 4-tube kit on the teenagers. You know, to get a 16-year-old girl to do anything is pretty rough. But if mommy takes the tube in there when she wakes her up in the morning and then sets the alarm and says, okay, you can't eat or drink anything, you know, 2 hours before bedtime, and takes the tube in there again to collect it. I mean, mommy has to do all the work and get it shipped usually, unless the teenager's really motivated. So I usually can only get a 2-tube test in a teenager. But kids are being given drugs for things that really should be treated through nutritional lifestyle. The very low dose hormone supplement, I've had tremendous results as it relates to some of these disorders in kids and teenagers. Okay, so last question? Okay. Well, tell me who, Sylvia.
Who's the lucky winner? This one right
here. Okay.
Sorry.
Yes, ma'am. Yeah, she's commenting about the saliva testing. If she's had blood testing and she's already on the bioidentical hormones, should she have saliva testing? I would do it. I think that it would be prudent to do it because, again, you want to know what's happening at the tissue level. And I didn't even get into so much data as it relates to cortisol DHEA ratios and all of these other important things in women's health. So I would still have it. Now, in the U.S., the saliva testing is covered by Medicare, Medicaid, Blue Cross Blue Shield, a lot of our insurances. But the problem in the U.S. is a lot of my patients can't afford insurance, or their employer doesn't provide insurance. So the patients are paying out of pocket for it. But I have not found a patient who could not figure out some way to budget for it, because it's such important information for her personal health. It's an investment in her that's going to benefit her husband, her children, her work environment if she is feeling better and hormonally balanced. I even had a patient in Arizona that lived in her car. This is how impoverished she was. But she wouldn't take charity, and she paid for the saliva test because she was educated. Even though she was impoverished, she was educated, and she understood the power of an accurate hormone assessment. So, maybe there can be an effort among women in Canada to say we want more elegant, appropriate testing intervention for us as we face the perimenopausal, menopausal transition. I mean, a group of determined women can do amazing things. And I appreciate your invitation to move to Nova Scotia. Talk to my husband about that. And I thank you for your attention.